Hello everyone, myself Rutuja Bhilar and my topic is anticholinergic drug. The subtopics are anticholinergic drug classification and pharmacological action of anticholinergic drug. So what is anticholinergic drug? Anticholinergic drug are class of drug which block action of acetylcholine on either muscarinic or nicotinic receptor. Anticholinergic drugs are of two types, direct anticholinergic and indirect anticholinergic drug. First, direct anticholinergic drug act by directly blocking muscarinic or nicotinic receptor. Second, indirect anticholinergic drug act by decreasing the level of acetylcholine, and the example is botulinum toxin. So classification of anticholinergic drug. Anticholinergic drugs are classified into natural alkaloid, semi-synthetic derivative and synthetic compound. First, natural alkaloid, and the drugs are atropine, hyoscine or scopolamine. Second, semi-synthetic derivative, and the drugs are atropine methonitrate, homatropine, hyoscine butyl bromide, ipratropium bromide, tiotropium bromide. Third, synthetic compound, which is further classified into four types: mydriatic, vasoselective, anti-Parkinson, anti-secretory, antispasmodic. First, mydriatics, and the drugs are cyclopentolate, tropicamide. Second, vasoselective, and the drugs are oxybutynin, fluoxetine, tolterodine. Third, anti-Parkinson, and the drugs are trihexyphenidyl, procyclidine or biperidine. Fourth, anti-secretory, antispasmodic, which is further classified into quaternary compound and tertiary amine. First, quaternary compound. Drugs are profanthalin, oxyphenonium, clidinium, isopropamide, propamide, glycopyrrolate. Second, tertiary amine, and the drugs are dicyclomine, valthalimate, pyrenzapine. Out of all these drugs, atropine is prototype drug. The receptor on which these anticholinergic drugs act are of two types: muscarinic receptor or nicotinic receptor. Muscarinic receptor are of five subtypes: M1, M2, M3, M4 and M5, out of which M1, M3, M5 subtypes are GQ subtype of G protein coupled receptor, and M2 and M4 are GI subtype of G protein coupled receptor. The location of this muscarinic receptor: M4 and M5 are mostly present in CNS. M1 receptor is also present in CNS. M3 receptor are present in GIT, salivary gland, bladder, circular muscle of iris, and blood vessel. M2 receptor are present in heart. Second, nicotinic receptor, which is further of two types: NM receptor or NN receptor. NM receptor is present in neuromuscular junction. NN receptor present at ganglion, CNS, and adrenal gland. Pharmacological action of these anticholinergic drug. First, by blocking muscarinic receptor. First, CNS. These anticholinergic drugs block M1 receptor in CNS, and the effect of blocking M1 receptor in CNS is decreased cognition, which is used in narcoanalysis, and the drug is hyoscine scopolamine. Second, eyes. Anticholinergic drug block M3 receptor in the muscle of iris, and the effect of blocking M3 receptor in eyes is mydriasis and cycloplasia. Third, lung. These anticholinergic drugs block M3 receptor in the lung, and effect of blocking M3 receptor in the lung is bronchodilation. These also used add-on drug in bronchial asthma. Drugs tiotropium, ipratropium. Fourth, heart. These anticholinergic drugs block M2 receptor in the heart, which stimulate SA node which increases heart rate and AV conduction. Fifth is GIT. This anticholinergic drug block M3 receptor in GIT, which reduces HCl secretion, which is used in peptic ulcer disease. Side effect of blocking M3 receptor in GIT is dry mouth. Second, reduced contraction, which is used as antispasmodic drug. 6. Bladder. This anticholinergic drug block M3 receptor in the bladder, which reduces contraction of dextrosal muscle, which is used in overactive bladder. 7. Gland. This anticholinergic drug block M3 receptor in gland, which increases secretion of various glands. Second, nicotinic receptor blockers, which is further of two types, NN blockers and NM blockers. NN blockers or blockers. Because of ganglionic block, there is decrease in norepinephrine release in postganglionic segment, which decreases blood pressure. This is used in treatment of hypertension, and side effect of blocking NN receptor is postural hypertension. Second, NM receptor is used in muscle relaxation. So the question on anticholinergic drug. First, anticholinergic drug work by blocking the action of which neurotransmitter? And options: A. Dopamine, B. Serotonin, C. Acetylcholine, D. Norepinephrine. And the answer is acetylcholine. Second, which class of anticholinergic drug is commonly used to treat symptoms of allergic reaction? And the options are: first, antihistaminic; second, antipsychotic; third, antidepressant; fourth, anticonvulsant. And the answer is antihistaminic. Thank you.